Welcome to the fifth webinar in our series. Today we will be discussing an important topic, research opportunities in physiotherapy, and it will be dealt by one of the eminent persons in our field. And I welcome Mari to introduce our speaker of the day.
Good evening, everybody. I welcome all the participants for this national webinar. And today's speaker is Dr. Abraham Samuel Babu. He is an associate professor in physiotherapy at the Manipal College of Health Professions, Mahi, Manipal. He is a graduate in physiotherapy from Christian Medical College, Vellore, and a postgraduate and doctorate from the Manipal Academy of Higher Education. He is an Endeavour Fellow and is one of the Australian Awards Ambassador by the Australian High Commission to India. He holds an honorary research fellow position in the Department of Cardiology at Austin Health, University of Melbourne. He has published over 70 peer-reviewed publications in leading cardiology and rehabilitation journals and has authored 5 book chapters, including one for the American College of Sports Medicine. He has also delivered lectures at prestigious international cardiology and cardiac rehabilitation conferences. And regarding his professional reputation, he has scored 18 H index on Google Scholar and H index of 12 at Scopus and ITEX index with 27 in Google Scholar. Is all overall indexed publications of 67 and 9 non-indexed online publications, and his average impact factor has gone 4.681 with the highest impact factor of 20.58. We are very proud to have you as a resource person, sir. I am handing over the session to Mr. Abraham, sir, Dr. Abraham, sir. Before that, I ask all the participants to mute your mic and turn off your camera. And over to you, sir.
Thank you, and it's a pleasure to be here today and to speak to you all. I'm just getting my slides up. Just a minute.
Yeah. Abraham, please open your video also.
Okay.
Camera.
Just a minute. Yeah, just a second.
Okay, thank you.
Yeah.
It's fine.
Fine now? All
yeah,
right.
Yeah, audible also.
Okay. All right, perfect. Thank you, Binash. And thank you all for this opportunity to come and speak to you today. So today we're going to be looking at research opportunities in physiotherapy, and the objective of my talk is only to sensitize you to what all is out there and what is it that you can do and how you can look at making use of some of these opportunities that are available. I understand you may all be at different levels in terms of your professional career at this point in time, but each of this is important to have, and even if you're aware of it, when the time comes, you will be able to make use of it and probably find things at the right time. So physiotherapy has grown over the years, and when I looked back at research, it was interesting to see that there was a first abstract or a conference proceeding, I think, published in 1913, and a first major paper, which was published in 1918. Now, a lot of the early work that came up from physiotherapy was all related to the defense and for those who are working within the defense, because that's where they felt the need was most for physiotherapy. But we know subsequently there has been a lot of shift in the growth of the profession. A search in PubMed revealed a very sharp rise in papers. And what we did see was that from 2000 onwards, there is actually a steep rise in publications, and that has gone up to almost 18,000 in the last year alone. And this is only bound to go higher and higher each day, each year. So that means research is taking a very prominent place these days, and there is a strong need to also publish your research. But why is it important? Well, primarily because research helps progress our understanding of various conditions, its interventions, the effects of interventions, and also works towards the growth of the profession. And you need to have a good body of research to back up everything you do if you want to look at autonomy for practice, especially in the Indian context, and also to advance the new ways of thinking and how are we going to look at things, what makes us ask new questions. So that is why research is important. I know many of you may feel research is way beyond my scale and I can't do it. It is for some people in big institutes only who can do it, or you need to have a lot of training. And I'll run through some examples of where all you can actually do your research, and you'd be surprised as to where all you can actually do your research. So commonly when we talk about research, the focus is always on clinical studies, because we feel that is where all research should be. It should only be on clinical studies because that's where it's going to have the greatest impact. But there are other forms, and that what I would like to introduce to you today are some of the other forms of research which are available and how they also relate to physiotherapy practice. So again, the idea being that we can probably expand our horizons and think beyond what we commonly know when we think even in terms of research. So clinical research, a very simple thing would be you want to study something on knee osteoarthritis, and you feel, well, if I can come up with a good intervention to look at managing knee osteoarthritis, I'm going to make a major impact in patient care, because possibly the right way to go, because you are looking at improving patient care at the end. And obviously you do develop a very clinically meaningful research question, but also it is taken in context with the available evidence that is there, so that you know whether this question has already been studied or are you again repeating something that has already been done. And commonly used research designs are randomized controlled trials, which everyone likes to do. If you ask any student for research, and they'll say, we want to do interventional study and we want to do a randomized controlled trial. Because randomized controlled trials have the best evidence, are the highest levels of evidence, but they are extremely complex. They are not easy to perform if done well. They require a good amount of funding. There are currently a lot of ethical and requirements and insurance requirements that need to be in place for conducting randomized controlled trials. So randomized controlled trials do come with their own challenges as well. The other option to look at is you just have a single group and you look at what is known as a pre-post, single group pre-post design. And that also works quite well. The third option is you can also do what are known as observational studies, where you just follow up participants at different time points or at a single time point, and you look at finding out relationships that may exist between certain variables or with patient factors. But all of these are very meaningful clinical research methodologies which can be used, and depending on the question that you have, you would obviously choose a particular kind of design. But other forms of research, like I said, also take the form of surveys, qualitative research, and systematic reviews. Now, surveys, we are all familiar. Nowadays, a lot of surveys are getting done. Online surveys can easily be done using Google Forms, Microsoft Forms, various other methods are there. You can generate an online form, circulate it, and you do get responses. Qualitative research is also something which is quite good to do and gives you a lot of in-depth information about a topic and about an area. But it requires you to spend time and effort either interviewing participants, either individually or conducting focus group discussions where there's a larger group of people involved. The third part, again, comes to systematic reviews. And recently, when we looked at the literature or the number of systematic reviews that have been published, it is the numbers of systematic reviews that have come up over the last few years are just phenomenal. It is crossing 300,000 systematic reviews in the last year, which is a very large number. And so these systematic reviews are in many ways considered equivalent to original research because they do have a very specific question. You need to collect data from the published articles in many ways, and there is a lot more which you can do even from systematic reviews. In addition to these, so these are again going to be clinically related. You can do all of these with a clinical research question. And depending on what aspect of it you would like to study, you can again choose the methods that you want. Now, there's an and there, and that means that there is something more. And this is what I really want to introduce to you, the need for other forms of research. And that is what I will come to in a little while. So what are the advantages? What does this have in terms of benefits? Well, the clinical implications are strong, and the final goal is that whatever you do has an impact on patient outcomes, and patient care, and that is what you're wanting to look at. And you would like for research at the end of the day to change practice. So if you see some of the old textbooks of physiotherapy, you will see that there is a lot of emphasis on certain forms of interventions and practices, which currently now we see that there is no evidence for many of them. So many of the electrotherapy modalities, for example, do not have sufficient evidence for us to use them in regular practice. And it is slowly changing. People have moved from those practice patterns and has changing over to newer forms. A simple example is the role of physios in ICUs, is that always it was thought that it is only respiratory care. But nowadays we find ourselves doing more of rehab and early mobilization. Respiratory care is still a component of it, but we have evolved and our practice has changed to also include early mobilization and rehab for these patients. So the other forms of, and many of times your clinical research.
Excuse me, Abraham, sorry to disturb. This is a technical issue. So many people are meeting outside. So we will just log out and log in again for 1 second, so that others.
So do I need to log out again?
Yeah. We will be just logging out. So all the participants need to log in again for a second.
Okay.
Abraham, you can start now.
Okay, just a minute.
Okay.
Right. Is it visible, Binoy?
Yes, Abraham. Yeah. Carry on. Sorry for the disturbance.
All right. No problem. All right. So we were talking about clinical research, and what we do see in clinical research is that a lot of time we focus all our efforts within this one single component, whereas you may actually have different others working on the same area, but we like to stay just within our sphere of it and think that it doesn't involve anyone else. But it is good when clinical research also involves other specializations, not just within physiotherapy, within rehab, but out of into the medical fraternity. So you can have very meaningful research with clinicians, with basic scientists, and others who are involved. And that is where we are now going to start looking at concepts such as multidisciplinarity and interdisciplinarity. So animal research. Now, this is something that many of you may have seen as being purely a lab-based study, and that there is no relevance for us. Well, there is a lot, because the picture that you see is actually a treadmill on which mice run, and you can actually have the mice train, so you can administer various forms of exercise training to the animals, and you can study the effects of various forms of exercise training on various aspects of the animal, from just clinical appearances or clinical presentations to cellular and gene related information. So this is something which you can definitely look at doing. And animal research is something which is lacking with regard to physiotherapy. And there are some concepts which may actually need to be tested in animals before we can actually start doing them in humans. And so animal research has a lot of scope when you try looking at what can be done with certain interventions which we may not be able to do very easily on humans, or for which we don't have sufficient evidence base, especially in terms of the physiological effects, and we want to study more about it. Animal research is one way to go. And the second way to look at it is also basic sciences research, which is many a time linked to a lot of the animal research that you do. You do look at basic biochemistry, you can look at pathology, you can look at various other aspects related to animal research, and you can get outcomes which are extremely meaningful. So for example, if you want to say that the effect of chest percussions is creates or maybe say massage removes some amount of histamines, you can actually do it and then check fluid or blood from a particular area and then see whether the levels of histamines have changed. We all read about it in our textbooks, but we can actually look at generating evidence for all of these. The last major point is with regard to translational research. Now, this is something where we need to start thinking beyond our comfort zones and actually move out of our comfort zone. So up to clinical research is what we are all very comfortable with, and we all like staying with that. Once you move out of clinical research and you try looking at animal research, you're automatically talking about doing something very different, learning new skills and doing a lot of things. And it is a big challenge. Translational research takes everything to the next level and is an integration of clinical research, preclinical, or your basic research, which is there. And you are looking at taking your basic research, what you've done from your animal studies, and taking it now to the patient and to the community at large. So you're now trying to bridge the gap from what was there in a lab and what you found to a patient, and overall you're trying to take it out to the community. So you're looking to have a major impact. And translational research it's something that you cannot do on your own. If you are trying to work only with your department and with your colleagues, translation research is something that is not going to work that way. So this is where you now need to start thinking about interdisciplinarity. And interdisciplinarity is where a lot of disciplines come together. They may be working on similar areas, and these black dots that you see are the ones that connect people from different professions together to work on a common objective or for a common reason. Transdisciplinarity is you have everyone working on exactly the same area, but from very different angles. Now, transdisciplinary is ideally research that can really move things ahead in a very large way, but it is also extremely complex because it involves you having to interact with a lot of people and having multiple people on board. But it does give you a fantastic result at the end of it, because you can work with engineers, you can work with software experts, you can work with those involved in artificial intelligence, you can work with pathologists, you can work with public health people, you can work with those in policy, in governments, clinicians, anyone. And these people all come together so that you can actually look at creating a project that has the largest impact on the community. And these are projects that will actually be able to reach the community in a much larger way and will be able to sustain through, because there'll be various aspects which have been taken care of. But this is probably the ultimate goal in where you're trying to bring your research to. It does start small. It does start with just doing simple, small clinical research, expanding it to beyond clinical research, looking at probably some preclinical research as well, looking at some basic sciences research, moving it one step further to try looking at some translational research. And of course, at the end, you're trying to look at a larger big picture and trying to see how big an impact you can make. So what does all this research do for you? And now we have talked about what its impact could be and where all it lies, but what does research do for you? It expands your horizons as a researcher. And this is something which is always important, that you never stop learning new things and exploring new things, because as a researcher, you need to keep going. And that's there within the term itself. It says research. So which means if you put a hyphen in, between, you get this research, which means you keep redoing it and you need to keep going back. So you are someone who needs to keep going back and looking at newer things that you can find. And it needs to give you a wider and deeper understanding into your subject. So what you learn in textbooks is the result of a lot of research that has already happened, and what you finally read is based on research that has happened. But if you need to know more about it, you need to start doing more. You need to be able to develop a deeper understanding. And when you do any form of research, you develop a much deeper understanding of the subject, and you also get a much broader picture about what it is, because you're not just learning about that one thing, but you're learning about that one research question that you have and everything else around it. So you automatically broaden your understanding. And it does, in many instances, make you think out of the box. And this out of the box thinking is what is very important. Research is not to conform to norms, but for you to think beyond. And a lot of people say, those who think out of the box, they call them dreamers. But those who dream are the ones who can think of newer ways. And sometimes a lot of ideas come just from a dream or an idea that you have. So there's nothing wrong in thinking out of the box. And people may sometimes find it hard to digest some of those ideas. But if the ideas are based on very strong foundations and a very strong theoretical construct, you can definitely look at exploring it further, and it may just very well give you something. So that is, again, a skill that you learn, and it develops over a period of time. So what are the opportunities that are available to you and I in the current scenarios that allow us to explore the avenues of research? What is it that we can do if we want to look at pursuing research in a much larger way? One is to look at applying for awards. Now, awards are usually given by professional organizations. Primarily, a lot of the international organizations do give you certain awards, and usually there is no restriction based on country, but there is sometimes a clause that you may need to have been a member of that association. So based on that, you may have opportunities to receive travel bursaries, which is basically a travel grant for you to attend one of their conferences. Or some of them also offer research awards, which may be small amounts of money, say within the ranges of $2,000 to $5,000 usually, which can be given, which is given to you for your research idea, which you would have proposed to them. So it is important to look at these opportunities that are put forward by professional organizations. The American Physiotherapy Association is one organization that does call for them, but again, I have no personal experience with them, so I'm not able to tell you clearly how they function. But some of the other associations like the European Respiratory Society, the Pulmonary Hypertension Association, for example, give out both bursaries and research awards for work. And those are actually very useful. The second option, which is also available, are fellowships. And fellowships are for research. And if you're looking at research fellowships, then you can look at Indian organizations such as ICMR, the Department of Science and Technology, and the Department of Biotechnology, which do offer research fellowships for those applying within India. If you're looking at foreign agencies, you have the National Institute of Health, the Medical Research Council, National Health and Research Council. So there are various other agencies which also offer you research fellowships. Now, these are fellowships which last for anywhere between 3 to 5 years, and these require sometimes for you to pursue a PhD, or for those with a PhD who want to further build and expand on their existing research. So there are opportunities available for these two levels at this stage. Clinical fellowships are also available, and again, some of the agencies, mainly professional organizations like the European Respiratory Society, the American Thoracic Society, for example, offer these clinical fellowships. Now, you also have fellowships which facilitate master's education. So for students who have just finished their undergrad training, and for example, Australia has what were formerly known as the Endeavour programs are now known as the Australian Awards program, which offers full scholarship for pursuing masters in Australia. So you also have these fellowships for academics and for learning. So like I said, these fellowships target every level of the professional spectrum. And whether you are a fresh graduate or you're someone who has already worked with enough experience, you can still look at these fellowship opportunities which are there. Research grants, that is probably where hardcore academicians would get into, and you're looking for funding for your work. And again, nationally, you look at major sources such as ICMR, DST, DPT, the DHR. Internationally, you can look at N number of agencies. There are just too many to mention. The prominent ones, again, would be the National NIH in the US. You have the Medical Research Council in the UK, the National Institute of Health Research in the UK, the National Health Research and Medical Council in Australia, and so on and so forth. You have various agencies which do offer funding for any kind of research grant. But when you are looking at international grants, one thing that is also important is to ensure that you have a good working collaboration. So you need to, it's good to have people with whom you have an equation with or you have worked with in the past to be on board with these international grants. It just adds much more value to the application. And also remember that if at all any of you plan to do international grants, there are a lot of legal requirements or administrative requirements from the government at present where you need to obtain a good number of approvals before you go ahead. So if any of you are thinking of doing international grants, please ensure that you follow all the requirements as laid out by ICMR. So what builds you to all of this and to help you develop, be it for a fellowship, be it for an award or for a grant, is to network and collaborate. Now, these are terms that are used very often, and people say, you know, let's collaborate, network with people. But a lot of times we say, you know, we can't do all that. That's not for us. I can't do that. I can't speak to people. I haven't reached the level of professional excellence that I would like to have. So I don't think I can do that. All those prevent us from actually looking and seeing what can be done. So I would like to just highlight some important facts and the benefits that come with collaborating. Now, from some research that has been done among from the published literature, what has been seen is that generally when there is a collaborator on board, there is usually the productivity of the researcher is better and there is a much higher knowledge impact. Also, the level and quality of publication that comes out is sometimes on the higher side when compared to if it was only within one institute or within just one department. So the collaboration does not always mean it has to be international. It can be even with other departments. It can be with other institutes within your region, within your country. It can be anywhere. The collaboration can be at any level you are comfortable with. Generally, what they have seen is that other than probably Brazil, Korea, and China, more and probably to an extent Japan and Malaysia, most other countries of the world are very willing to collaborate and are happy to work with people from other countries. The other thing to also help you is to use a lot of the social scientific network. And this is something that is fairly new to the academic realm and to the research realm, where we are not very comfortable using a lot of this. But it is important to use many of these. And a lot of you may be already using Facebook and Twitter for your own personal posts. But these networks and these databases can be used quite effectively for professional growth, for building collaborations, to get in touch with people. And that is something which you can start exploring these days. So you can always follow a certain group, you can follow a journal, you can follow a topic on Twitter, and anytime there is something new and there is a tag to it, you obviously get that information and you can obviously see what is happening and you stay up to date. So social media is also useful to staying updated with what is going on in your field. ResearchGate is again another scientific network that can be used to reach out to researchers of similar interests, read some of their work, and also get in touch with them to receive copies of their work, like their papers and other things which are there. So these do form good platforms to network and build ties with people. So I just thought I should share with you a few tips that you could use to help initiating, building, and sustaining these collaborations. So this is not something that is very easy. It is something that takes time. And collaborations and networks take time to build. And like any network, you need to build a relationship and a rapport before things move on to the next level. So the best places to do these are obviously a conference and workshop would have been ideal, but we now know in the current scenario that's out of the question. Institute visits are sometimes again useful. So if you are visiting a place, for example, you could always write to the university where you're going, even if it's just somewhere there, but you just happen to be in the area and you want to visit the department, you could write to them. You get all the information from their website. Please do not go there unannounced, because that does not set a good image. Write to them and see whether they encourage visitors to come and whether it is possible. And if they do give you a time, you can look at going there. In the virtual world, it's, I think, a lot easier. You would come across a lot of people through webinars, through conferences which are going on online these days. And you could always, many of them have the contact information with them. So that is one way to get the first step. And obviously you look at initiating by writing an email to them, introducing yourself and who you are, what you do, and what your interest is. So don't just write out an email saying, hi, I'm so-and-so, and I just want to get in touch with you. it sometimes is all right, but it's also good to be clear about why is it that you want to get in touch with them. Is there something you would like to learn from them? Is there something you would like to know more about from them? And that helps build a rapport. There are times you may just want to just write an email to someone and say, I have read so much of your work. You're an inspiration. Thank you so much. And it's just 2 lines, 3 lines of an email, but that also makes a big impact. And you never know how these things go on. But you obviously start with an email, a good email introducing yourself. When it comes to building it, obviously you have to think about, if you're going to write a paper, you want to know who's going to write what is the order of authors, who's going to contribute. Always remember that you don't just always take on everything that comes your way. There are times you may have to say no because of your other commitments. And as far as possible, try and be inclusive. So if you feel that there is someone else in your department or your team who may benefit from this contact, and if they are willing to take things forward and they're doing good work, introduce them, because that can also help build the relationship. And obviously look at expanding your sphere. So don't think that I need to get in contact with only people who are physiotherapists. Let me get in touch. Look at others who are there. A lot of the contacts whom you do make over the years, and a lot of areas where you can start diversifying, is by getting in touch with people who are not only within your exact area of work. So be bold and think beyond. There's nothing wrong in that. That will help you. Sustaining it is hard. It does require a lot of persistence. You need to be staying in touch with them, but not bugging them with things. So, make sure that you know what you're getting in for. If there are deadlines that you need to meet, ensure that you meet them, and always be willing to acknowledge your limitations. Don't be hesitant to say that you're not aware of something or you do not know something, because it is good to be honest with whoever it is you're collaborating. It doesn't have to be someone who's abroad, but even someone from India. It's anywhere within your institution. It's always good to say that this is something you're not familiar with. It just clears things up much better. So these are some of the collaborators I've had the privilege to work with over the last maybe 10 years or so. And each one has done a lot in terms of improving either my research skills, my clinical skills, my research writing, my understanding of the subject. Each one has worked to build, and that is where you're looking for mentors and collaborators at the end of the day. So the importance of working in research, taking things forward, and working with a good team of people may not always be from your institution, but maybe from all over the world, is that you end up with really good scientific output. You do obviously build your CV, which again builds for better success when you apply for fellowships. Working in an area where you are specific and very dedicated to helps you build your expertise in that area. It helps you again have other appointments and holdings within other institutions. You are recognized for your work by agencies, and remember that whatever professional growth and visibility that you gain also benefits your institution where you are. And all of this is completely worth it. The effort is tremendous. It takes a lot of time and takes time to build, but end of the day, it is definitely worth it. So my take-home message for you today is think big. Don't be afraid to think out of the box. Don't be afraid to explore new avenues of research. Be bold, and don't think that, oh, that award is not for me, that fellowship opportunity is not for me. There is no harm in wanting to apply for it, sending out an application. At the most, they may tell you, you may not be eligible at this point. It doesn't matter, but you have taken that first step towards exploring it. You have taken a step towards building a network, getting in touch with someone, collaborating with someone to work on that application. And that in itself is a big learning process, and that itself will help you build your network and over a period of time take you to where you are. Thank you so much for your attention. I'll be happy to take any questions you may have now.
Participants can put their queries in the chat box. Thank you. Due to the technical issue, many of our clients couldn't join. So they are trying to accessing through YouTube. So we have sent the link. So we'll just check the
All right.
queries there also, Abraham.
Sure, sure. Yeah, no problem.
Okay.
I think there's one question from Mr. Subin on, can you suggest any institution for PhD in India? There are various institutes that offer PhD, and my suggestion for you would be to look at institutes which have the infrastructure that you want to look at. So if you're looking at a specific area, it's good to see if there are guides in that institution who are specialized in that area, and then take it forward for that. I don't think it's right for me to name institutions per se, but I would suggest go with where you will find the expertise to guide you in the area of research that you would like to move forward. Okay.
Question from my side. How to find funding agencies, Abraham?
So funding agencies, that is still a challenge. For foreign agencies, there are usually newsletters that you can sign up to, which will help you give you the information about funding opportunities that come up from foreign universities. Mainly the Fogarty Institute is what covers a lot of the international US-based grants, at least. But a lot of times the information is purely by going to these websites. So if you just generally hit a search for funding agencies in health sciences, if you search for funding in physiotherapy, the chances are you may not find too much. But if you look for funding in health sciences or in medicine, in health, you may still find more organizations coming up, and that you can then go to each website. It's a process, but you will need to go to each website, see what their normal cycles are. They usually have a timeline that is listed, which tell you, these are opportunities that you can take off. They are coming up at this time and this time. From the Indian side, again, it's pretty much the same, but there is also a newsletter known as the India Bioscience newsletter. I think it comes from DBT or one of them. And that's something you can register for. It does give you some information, but not all the information. So it is still advisable that you go and check out the ICMR sites, the DST sites, because they keep putting up the information only on their websites usually. On that note, I would also like to inform the audience that the Society for Indian Physiotherapists is calling for research grants at this point, and I think it is on the website. So there is a call for students, for practicing clinicians, and for academicians to apply for research grants on various topics and themes. So I encourage you to please go to the website and see if you can, if you have a topic of interest and you would like to apply for that, please do make use of this opportunity and apply for the grants from SIP.
Okay, thanks a lot for the wonderful input, Abraham. And another query has been put by Subin sir. According to him, he asked, can we collaborate with ICMR? What is the procedure according to your perspective?
We can collaborate with ICMR. Again, it needs to match their areas of focus. I personally do not have experience with working with ICMR, but I know of others who have worked with ICMR. And it is usually based on the division that you're applying to. So if it is the non-communicable diseases division, and based on the calls that they have, you need to speak to the scientist who's in charge and then look at collaborating with them. It can definitely be done, and I think they are looking out for collaborations for sure. There was one question up previously about from Mr. Vijay. Could you explain strategies or skills needed to improve research skills for physiotherapy students? Now, I think that's a very challenging question, and that's something that a lot of institutions are trying to do. One option is obviously to engage students in some form of research right from their undergraduate days. I know many of us, there have been times where a lot of people have felt that research should be, after qualifications. But if you look at a lot of the institutions abroad as well, and the high-performing ones, research is introduced right from the beginning. And one thing that we have done at our institution is to have student research forums where students are given the opportunity to work with faculty on projects or be mentored by them, and also present their work at conferences. And I think those are small ways by which you can look at improving the research skills that physiotherapy students will need in future. It is a process, so don't expect a change overnight, and it involves the entire system changing and adapting to the need for research and building research capacity across all levels. This is the question: how far are online research studies accepted by journals, and how is the impact during these COVID times? Online research is valuable, though it gets placed lower down in the evidence hierarchy. And that is primarily because there is a significant amount of bias that is involved. So even though it is good, it is sometimes useful to especially understand practice patterns in an area where it's obviously impossible to reach everyone any other way. The value of it is always there. The impact of it is there, depending on the question that you're asking. But I think journals look at the impact of the survey rather than the survey itself. So usually response rates are one criteria that need to usually be good for most surveys, but there are also times you may not know or be able to calculate a response rate, which is also acceptable. But many a time you need to ensure that whatever information or the reason why you're doing the survey meets a strong research need. And if that need is strong, journals are still willing to take those kind of studies.
Ephraim, can you kindly elaborate on the current research works you are involved in right now?
Okay, so my research is focused on cardiac rehab, and I focus my work primarily looking at delivery of cardiac rehab for patients with heart failure and pulmonary hypertension. We are involved with some amount of collaborative work within India and outside India. And we are also involved with some amount of animal research and translational work looking at exercise and pulmonary hypertension. that is the current areas of work that I'm involved in at present.
Okay, Abraham, like thanks for the wonderful inputs. And today, I guess it's a happy day for Manipal because officially Manipal has been made into an institute of eminence by the ministry, and
Yeah.
I guess you will be happy to be part of the institute.
Yes, definitely.
And and thanks a lot for spending time to impart such wonderful insights to our students. And unfortunately, the major chunk of the students couldn't enter in, though we tried the things. Google Meet has its own issues. They were still sending emails. So we'll be putting it, we are recording the content. So we will be uploading it in our official Facebook page, so that those who missed will also will benefit from the video presentation.
Sure.
And I would now invite Fatima Sumaya to deliver the word of thanks. Fatima.
Hello, sir. Uh, Good evening, all. The webinar was really informative and it had imparted a great deal to add up our knowledge and expertise in research activities. On behalf of CRC Kozhikode and Department of Physiotherapy, I extend our immense gratitude to Dr. Abraham Samuel, sir, who accepted our invitation and presented the topic in most simple and best way. I owe our thanks to all the participants who attend in the webinar. We hope that this webinar has enriched your knowledge and we look forward your presence in future webinar. Thank you, sir.
Thank you so much, Fatima.
Oh, thank you, Abraham. And though you have crossed the 1,000 mark years citations, we are expecting more from you in the upcoming years.
Thank you, Binoy, and thank you to the team at CRC Kozhikode. Thank you so much.
Okay. Okay. Thank you, Abraham. And thank you, participants. Sorry for the glitches conveyed to your uh, students and your friends. Unfortunately, we couldn't uh, correct this sort of the issue. We tried our maximum, and we are looking forward to meet you all in the upcoming webinar. Thank you.